of you once again. I'm Francis. I'm the program director working in a medical college hospital in Kerala. Kerala is the southernmost states in India. I have been working in this field for more than 30 years now. I am 55 years young. So let's start. I wish to see all of you. Please switch on your videos. Is it possible? So that,
Yes, please.
yeah. So that I take a picture of you also. Can you all switch on your videos?
Yes, sure.
Yeah, please. Let's see you. I wish to see you all. I want to make sure that all are human beings.
Yeah, no. We are not aliens. Yeah.
Because I want to take a picture and then put it in the Facebook so that I get many likes, many comments in the Facebook. all of you, please switch on your videos.
Yeah.
Please don't waste our time. Please switch on your videos.
Yes. Open, please.
Please switch on your videos.
Dr. Ung, please.
Oh no. Okay.
Perfect. Wow. That's all.
Okay. Let's start then. I have been doing this sorts of training, virtual training, from the very beginning of the pandemic. Our medical college is one of the education providers of the Colombo plan. So we already conducted 2 training programs on child addiction. Tomorrow, we are starting another training on advanced UTC, that is relapse prevention and recovery management and skills for comorbidity management. We wanted to involve all the participants from South Asian countries, but with the changing laws in India, we are not supposed to receive foreign aid, foreign money. You see, we charge the participants a fee, a small fee. Each participant has to pay for the training. So what happened? When we receive money from other countries, there are certain issues. So we are not taking foreign students. Otherwise, we would like to have you all for the training point of time. So thank you. So I think I conducted more than, say, 40 webinars during this pandemic. So I consider pandemic as an opportunity not as a danger. Many of you may know the word crisis come from Chinese words, two words, that is danger and opportunity. Let us take this pandemic, this COVID situation, because I see many of you are on your mask. I also have my mask here, hanged on my window, because it's my office. Please do not be feeling danger about COVID. COVID has given us an opportunity to learn and to acquire skills. I, being a 55-year-old, not old, young person, have learned many things during this COVID. Example, how to conduct virtual training, how to make use of Google Forms, how to prepare posters using Canva. There is a site called Canva. So all these things I learned during this pandemic. So I start with the session requesting all of you to feel happy, make a lot of fun through this virtual platform. Doesn't matter, we don't see face to face, but we can see us through this platform. So whenever I request you to switch on your video, please switch on and let us see each other. Let us see our loving faces, the beautiful faces from Myanmar and Thailand. Like Dr. Prapun said, I wish to be in Thailand now with my best friends in Thailand. I also have friends from Myanmar, a lot of them. So let's make a lot of fun. As part of the fun, I request you, please clap, virtual clap. Please clap, all of you. Yeah. All of you, please clap.
Clap, clap.
Yeah. Okay, good. Clap on your shoulder. Please clap on your shoulder. Like this. Yeah. Clap on your shoulder. Like this. On your head. Yeah. 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 Good. So likewise, please do it during the session when you feel stressed, when you feel anxious, when you feel tired. Clap like this, clap like this, clap like this, clap each other, so that you get relaxed. Okay. Now it is time we start our session. Please make sure your audios are, your microphones are turned off, switched off. This session, just half an hour session. In face-to-face meeting, the whole module is for around 3 hours or something. That 3 hours we have cut short into 30 minutes. So you know what we are going to discuss. Just hush through. Just go quick. Don't worry. I will make it very sure that we all understand. We are discussing what is psychoactive substances, where it affects in our brain, what are the classifications, what are the types of drugs abused, what is the progression. These are the things that we are discussing. What is psychoactive substances? How it affects our brain? What are the classifications? And how the progress of addiction takes place. The 4 different stages of progression. Okay, now I shall share the PPT. Are you ready?
Yes.
Yes. Okay, let's share it. Can you all see it? Hello?
Yes.
Yes.
We can see.
Okay, let's go one by one. I discussed it already. That is, in this particular session, we are discussing what is psychoactive substances, how it affects our brain, our body, and then we also discuss various categories, types of psychoactive substances, how it is administered, means how people take it. When they take it orally, they inject it, puff it, etc. We also discuss the levels of progression. So now let's see first, what is psychoactive substances? Substances means something that could be in liquid form, that could be in a gas form, in whatever form it is. It's a substances that is taken or administered in different ways. Generally, the substances affect our central nervous system. Central nervous system consists of the brain and the spinal cord. We all know what is brain. Of course, many of us who are doctors have already seen what is a human brain. So, the central nervous system is consisting of these two. And then, when people take it, when they take drugs, it changes the way they behave, the way they perceive, and the way they see things around them. Simply means psychoactive substances change our perception, our views, and our behavior. This is what is called the central nervous system. As I already told you, central nervous system consists of the brain and the spinal cord. We know without these two, without the brain and the spinal cord, we cannot live. So these are two important organs in our body. It is here, it is very important to know that any drugs or substances that affect our brain and the spinal cord, which what we call is central nervous system. This is another concept about blood-brain barrier. Blood-brain barrier is what is called a group of cells tightly pressed together so that it allows only certain chemicals into our body. It's like a membrane that covers our brain and protect our brain. How does it protect? This brain barrier, blood-brain barrier, does not allow certain chemicals into the brain in order to protect our brain. This is called large and water molecules are blocked, are not allowed into the brain. Like antibodies, antibiotics, and other medications that we take is not allowed by the blood-brain barrier. Because these are the medications that has large water soluble molecular, so that it cannot enter through the passage of the brain. Whereas small and fat soluble, that means it is easily soluble, that can enter our brain easily, because the blood-brain barrier allows these small and fat soluble chemicals or substances to enter into our brain. Most of the substances that are abused has this structure, so this enters into our brain and directly affects our brain. So 2 points. There are certain chemicals that cannot enter our brain because of the blood-brain barrier. There are certain chemicals that can enter our brain because the blood-brain barrier allows it. And drugs, that is psychoactive substances, can enter our brain through this blood-brain barrier and have a direct effect on our brain. That is how this addiction takes place. Pharmacology. What is pharmacology? Many of us know. Pharmacology means is a branch of the studies or a science that studies the effect of medications and how it affects our body and the brain. So that is pharmacology. Half-life. What is half-life? See, any substances that enters into our body takes its own time to absorb, metabolize, and eliminate. Any substances that enters into our body takes its own time for absorption, absorbing, metabolizing, and eliminating. Half-life means the amount of time it takes to eliminate half of the original dose of the substances. Half of the original dose of the substances. That is called a half-life. That means when a substance enters into our body, it takes a time, and half of it, the original dose, gets eliminated. At that process, that time is called a half-life. Generally, some chemicals or some substances takes longer time. Some substances take very less time. whichever substances take lesser time gets addicted, or we get addicted to that substances we have more craving. Substances like heroin takes a very limited time, very small time, 2-3 minutes only it takes. And whenever a person takes substances like that, they easily become dependent on that substances. So this is what is called a half-life. I say once again, half-life simply means the eliminating time of a substances. The amount of time takes to eliminate half of the dose of the original dose that we are taking. Now let's go to the next topic. Other factors. This elimination process is also important. It's important like the age of the person, the length of the time the person has been taking it, and the amount of the substances the person has taken. So half-life depends on not only this, it also depends on age of the person. Younger people and the old people, whenever they take the substances, the half-life differs. The amount we take, how much amount we take. The amount means the dosage. Example, 1 ampule, 2 ampules, etc. So all these things depend on age of the person, the length of the usage, and the amount or the quantity of the substances that a person has been using regularly. And how it is absorbed, how it is metabolizes, and how it is eliminated. This metabolizing process is what that in our liver. Liver is the important organ that breaks down the substances we take. Once it breaks down, the metabolic process, the metabolization takes place. And then it is eliminated. For the elimination process, kidney is the one who supports the liver. I mean, there are two organs that are primarily involved in metabolization and elimination process are the liver and the kidney. So whenever we take a drug, it first absorbs it, then metabolizes, and then eliminates. What are psychoactive substances does, or what does it do in our body? Any substances, whether it is alcohol, whether it is tobacco, whether it is MDMA or heroin or opioids, it alters means change our mood, thoughts, sensory perceptions, and behavior. Mood, of course, you know, the high mood, the lower mood. Whenever we call it mood, we are in a happy mood, we are in a sad mood. Some people are in a very different mood, indifferent mood, we call it. So whenever a person takes it, it changes his mood. Thoughts means thinking pattern, the way he thinks. Sensory functions. You know, there are 5 senses: eye, smelling, touching, etc. So all the sensory perceptions changes whenever we take substances. And as a result, what happens? It changes the behavior of the person. How does it change the behavior? Because when we take a drug, example, cannabis, that is marijuana, when we take it, first change our mood, it change our thoughts, then the thinking, then the sensory perceptions. Some people, when they take cannabis or marijuana, they get hallucination. That is auditory hallucination, maybe visual hallucination, sometimes tactile hallucinations. So the perception changes, the way they see things change. And perception changes brings change in their behavior. Some people become very calm. Some people experience euphoria. Some people become violent depending on the type of the drug they take. So this is psychoactive substances which changes our perception, our mood, our behavior, and our thoughts. Effects of psychoactive substances. We will be doing effect of psychoactive substance detail throughout the course. Now just know the effect of the psychoactive substances depends on substance that we take. It can be positive, it can be negative. What I mean it can be negative? Or substances, when a person takes, he may become violent. Certain substances, when we take, we may become very happy. We may have a very happy mood. So what it is called, it can be negative as well as positive. It is what type of drugs we use. Classification. You see, the classification of drugs is very important. How the drugs are classified? The substances are classified based on the effect it makes on our brain in the central nervous system. How it interferes or brings changes in the brain functioning. Basically, there are 4 classifications, 4 types. And then we have a subtypes. There are subtypes because they cannot be categorized into a specific category of drug because of their effect is different and it produces different types of effect on the brain. Let's see the categories. Can someone say, without seeing the slides, what are the categories? Some of you can speak. Hello? Hello? Can you please speak? Some of you? Hello?
Yes.
Yeah. Could you please tell us what are the categories of drugs in your Myanmar and Thailand that usually you?
Meth,
Yeah. Types of drugs.
stimulants and depressants.
Stimulants. Of stimulants, what is the most commonly abused drug in your country?
Methamphetamine.
Methamphetamine. Okay, good. Okay, somebody else from Thailand. What is the commonly abused drug in your country? From Thailand? Hello?
Yes.
Yeah.
Are there any participants from Thailand would like to participate?
Yes, it can be caffeine and also methamphetamine.
Okay. Okay. Okay, that is stimulant. Amphetamine is stimulant. Okay. Now, let's, because we have very limited time, let me try to finish it. The first category of drug or is stimulant. So it is stimulant because it stimulates our brain. Generally, they are cocaine, amphetamine, methamphetamine, nicotine, and caffeine. So, nicotine or caffeine, that is legalized. The other drugs are illegal drugs. And then is opioids. Opioids are also called narcotics. Previously, this particular category of drug was called analgesic. Why it is called narcotics or analgesic or opioids? Because these are drugs which are used for pain. In other words, these are painkillers. Opioids, both natural and synthetic drugs are there. These drugs like heroin, morphine, opium, and Demerol. These are the drugs that come under the opioids category. In our country, that is India also, there are many people who abuse opioids. When I was working in Afghanistan, one of the commonest, very commonly used opioids was opium. Many people in that particular country use opium. The third category is depressants. Depressants means a drug that depresses our brain, the central nervous system. The first one and the very common one is alcohol. Then barbiturates, benzodiazepines. Among us, there are many psychiatrists and psychologists. We know that benzodiazepine is very commonly used in our OPD clinics, in our IP clinics. They are the prescription drugs prescribed by doctors and medical practitioners. Then GHB, GABA, Renon, all these are depressant drugs. Nowadays, there are many drugs that are being abused by youngsters. Prescription drugs are abused. Other depressants are very commonly abused. And actually has an depressive effect on our central nervous system. The fourth category, they are hallucinogens. Hallucinogens, the very word says that these drugs, when you, people may have hallucination. You know what is hallucination? Hallucination, illusion, delusions. Hallucinations are seeing or hearing or experiencing those things that are not being original. We happen to see what does not exist. We happen to hear what really does not exist or not happening. So that is why this is called a hallucination. Under the hallucinogens drugs come LSD, mescaline, those are the natural drugs. Ecstasy. Ecstasy is also called MDMA. Ecstasy can also be categorized or classified under stimulant because ecstasy has both effects like stimulant effect as well as hallucinogenious effect. And then comes mushrooms. Mushrooms are natural drugs, naturally grown plants which are either eaten directly or with chocolates or honey. Some people in our country make food like they prepare a kind of food and then eat it with mushrooms. Mushrooms are generally eaten with chocolates or honey. Apart from these four categories, okay, let's see. There are two drugs that we have marked red. Can anyone say why they are marked red? Alcohol and nicotine are marked red.
They are legal.
Yeah, very good. They are legal drugs. Alcohol, nicotine, coffee are legal drugs. That's why they are marked as a or taken to get an effect on the central nervous system. I already explained this. Other drugs, apart from the four categories of drugs that we already explained, stimulant, depressants, opioids, hallucinogens. There are some other drugs which cannot be categorized into those categories we already discussed because effects it brings. Number one is cannabinoids. They are called marijuana, cannabis, hashish. In our country, there are so many different types of cannabinoids. Cannabinoids are into a different category because cannabinoids or marijuana brings different effects on the brain. Sometimes it is a stimulant, sometimes it is a hallucinogens. Previously, some studies claimed that cannabinoid also is a depressant. But nowadays, they say that it is not actually a depressant. Different effect on the brain for different people. Could be a stimulant, it effect. Since it can bring like effect on the body. Like a person takes cannabinoids, he may experience euphoria, relaxed mood, etc. So this is into that category. Then comes cat and mirror. They are this and cat is a drug, naturally grown drugs, generally seen in Africa. This is also a different drug which may bring hallucinogenic effect or a stimulant effect. People can become violent when used. Then PCP. It's a kind of anesthetic drug which brings a relaxed mood into the persons when used. Or sometimes they become stimulant like ketamine. Then comes inhalants or solvents. Inhalants are drugs, not drugs, substances which are common for like action fluid, glue, cleaning agents, petrol, thinner, paint, etc. These substances can also be abused. Any question about the classification of drugs? Otherwise, we will finish up because it's time already. Any question on the classification of drugs? Hello? Nobody is speaking?
Dr. Francis,
Yeah.
I think it is very important. You can take more time. Yeah.
Okay.
Very good. Very good.
Yeah. Okay. Let's have a discussion, small discussion. All of you, please. Can you all discuss on the classification of drugs? Some of you, please talk about different types of drugs that are available in your country or abused in your country. Hello, my dear friends. Are you sleeping? Are you sleeping?
Yes.
No.
Yes. But sometimes
Awake. Think about your girlfriends. If you are sleeping, the best idea to get awakened. Think about your girlfriend coming to you with a sword to kill you. Okay? Please awake. All of you, please. Come on, join. This different types of drugs. Nobody. What happened? All sleeping, or they just logged in and went away somewhere else? Only I can see Dr. Arka. Nobody is seen. Nobody is heard. Oh. Hey. What happened? Come on, please.
This is very good.
Yeah, please, sir.
So then,
Sir.
what happened to us is sometimes are some of the antihistamines. So antihistamine also can make us sleepy, and sometimes we fell into sleep. We take the antihistamine like a chlorpheniramine or something that can kind of our medication make us our addiction.
Yeah, that's
you.
a good question. That's a good question, Dr. Tin. As I said, I'm working in a medical college hospital for the last 25, 30 years. My experience is any medications, very importantly, psychiatric medications can be addictive, but the potential, the addictive potential is not as high as others. It can be addictive because, as you said, this particular drug can cause relaxed mood, and you may go into sleep, may become sleepy, etc. So these particular drugs that are being for psychiatric disorders, there are many people who get addicted, but the addictive potentiality is not very high as other drugs like heroin, MDMA, or any other stimulants. The addictive potentiality is much low. So we cannot say that we should not give these medications. But this medication should be given under the supervision of a psychiatrist or a qualified medical practitioner only. In other words, it should not be self-medicated. You or I should not prescribe it without the advice of a qualified medical practitioner. Then it is okay. Otherwise, there is a chances of addiction. Is that okay, Dr. Tia?
Oh, yes,
Dr.
thank you.
Yeah, thank you.
Okay.
So please don't.
Yeah, Dr. Francis,
Yeah.
may I add some more information about the addiction regarding this kind of drug?
Okay, please.
Okay, for example, like antidepressant for like amitriptyline or like acetylcholine, and
Yes.
we cannot say that they can be addictive, but in other means, when the antidepressant, they are taken for the low mood or some harm that they for the sleeplessness.
Yeah. Yes.
Yes, psychiatrist prescribe for an asset antidepressant or like like a sleeping pill, but they cannot addicted, but they can produce a discontinuation symptom. What we call discontinuation symptom is after we stopping the medication, the previous symptoms like insomnia or like the low mood can rebound. They are we cannot say this type of drug are addictive, but we call it they can produce discontinuation symptoms when we stop this kind of medication. So I think the addiction, we can say addiction only if they can produce the withdrawal symptoms after we stop in the drug, like heroin. We can produce like sweating or like muscle ache and pain. So we call we I think this kind of category of drug fall into the addicted drug. But like the chlorpheniramine, like Bamidon or like other drug, we cannot. They are not fit into the addicted. I think they can only produce the discontinuation symptom of the previous symptom, I think.
I've also seen some patients with osteoarthritis, and they took corticosteroids over the counter.
Okay.
And
Okay. I got disconnected for a moment. Sorry. Let's come back. Can you all hear me?
Yes, but we cannot see
Yeah.
you.
Can you see now?
Not yet.
It's still
Okay.
green.
Okay, it is connected. Let me share and see whether you can see me. Okay. If you can't see me, it's okay, but sharing, okay or not? Let me see.
Yeah, it's okay now.
You can see?
Yes.
1 second, please. Just hold on. Please hold on. Second, just okay. Now it's okay.
Yes.
Yeah. So let's continue. Okay. Now, as Dr. Parpon said, any psychiatric medications, antidepressants, amitrol, all these generally does not get problem or does not create any problem for the users. But it has to be prescribed by a psychiatrist or no. It should not be like a self-medication because it has a very less addictive potential. It can be and you need to be very careful about it. That's all. Now let's go to the routes of administration. How people take it. Administration means the ways they administer it. How do they take it? We know that we take orally, that is through the mouth, snorting, smoking, inhaling. Inhaling is done generally the gas like inhalants are generally inhalants like glue, petrol, thinner, pain, are inhaled. That is through the process called they keep on the face and then inhale it. Intra is injection given through the muscles, under the muscle. Subcutaneous is given the skin level, a little skin level. And intravenous is given in the veins, directly into the veins. Generally, these three forms of administration done in hospitals by nurses and doctors. But people who are using drugs, they by practice learn to do these intramuscular injection with subcutaneous, intravenous, and topical. Topical is applying on the body, on the hands or wherever they just apply. You know, like you put balms on your body, they apply on the body. That is called topical. Sublingual, you put under the tongue. Certain drugs are kept under the tongues. So these are the different routes of administration. Of these different routes, some routes of administration are faster, some are very slow. Example, smoking brings faster effect in the brain, whereas topical methods brings very slow effect on the body. That means when you smoke a drug, the effect is very quick and faster. When you swallow, when you put on your body, apply on your body, the effect of the drug in the brain is very slow. Now let us see Smoking takes only 7 to 10 seconds. It is the fastest mode of administration. I mean, the speed of action. The brain. That means when you smoke a drug or a substances, body or in the brain is faster. 7 seconds enough. Injection, intravenous injection. There are different types of injections like intramuscular, intravenous, subcutaneous. Whereas intravenous is given through the vein is faster, just 15 seconds to seconds. Then injecting through the muscles or under the skin, that is subcutaneous, takes 3 to 5 minutes. So the fastest mode is smoking. Second is intravenous through the veins. Third is intramuscular, that is through the muscles. Mucous membrane absorption, that is snorting through the nose or a rectal process. That takes 3 to 5 minutes. Swallowing, that is drinking. Taking through the mouth. We drink certain tablets, mouth, orally. Orally, that brings the effective 20 to 30 minutes. Why when it takes longer time? Because it goes to the stomach first and then it has to be to the bloodstream, and in the liver the metabolical process takes place. Metabolization takes place in the liver, the breakdown takes place in the liver. So it takes time. Whereas when you inject it, the drugs directly goes to the bloodstream and the liver start breaking down it. So that is faster. The effect on the brain is very quick. Finally, the slower process, very slow, which take a long period of time, is through skin. That is topical. When you apply on the skin, the effect on the body, the action takes very slow. So that is the fastest mode and the slowest mode. The fastest is the speed of action when consider. The fastest is smoking, just 7 minutes. Lowest is topical, applying on your body. Now this is a group discussion. Organizer Dr. Chitu or Dr. Parapur, can we make a WhatsApp group of all the participants? Is it possible?
Professor, did you make WhatsApp group?
WhatsApp group.
Or
I mean, create a WhatsApp group so that the participants discuss, have group discussions while they are in the home or off time. They write, they bring their discussions, they prepare some pictures and then post it in the WhatsApp group so that the trainers can see, participants can see each other, whatever they discuss.
I think we have
create a WhatsApp group.
I think Dr. Francis, I think we prepare the breaking session that Dr. Chisu will invite the participant discuss in a small room. We prepare a small room so everyone can join, because Dr. Chisu will invite everyone join. And after finish discussion session, we will return to the main room. And this is it maybe is up to the trainer need. For example, if the trainer needs 5 or 10 minutes, a small group session, we will break to the small room and invite some participant or I don't know how many participants for the small group. And then Dr. Chisu will, when you finish the small group discussion, she will invite all of you return to the main room. Yes.
Yeah, Dr. Purple, I understand that. I understand that. I know that the break rooms, whenever we don't have time for the break room, we can also have group discussions, giving some homework. You know, homework can be done through, this homework can be done through group discussion in the WhatsApp. So if you create a WhatsApp group, they it through the WhatsApp group, and the trainers also, please include the trainers in the group, so the trainers can give their comments. So this particular exercise, I request the participants to discuss in the WhatsApp group. We are not going to have the break room now because we have limited time. So discuss in your WhatsApp group what you have to discuss. You just discuss what are the main type of drugs in your country, what are the most commonly used drugs in your country, what type of drugs is the most commonly abused, what are the different mode of administration used. For example, in our country, cannabis, that is marijuana, is used not only by smoking, but also they drink, they boil it and they drink. So all these can be different routes of administration that being practiced in different countries. So these can be discussed in your WhatsApp group if you have a WhatsApp group. It's something like a homework or an assignment. Please go ahead if you can include all the trainers so that the trainers also will know what you are discussing. All my friends listening me, participants, respected participants, please come up with some pictures like children. Let us learn through pictures, drawings, some mimicries or fun or whatever it may be. So this is my request to all of you. I am going to finish up with the last slides because I already took some time of few hours. I'm very sorry. This is the first time. Tomorrow onwards, we will stick on to the time. Progression of use. The progression of use generally takes place in 4 steps. In the first step, we use drugs as an experiment, just for recreation. In the second stage, slowly, this recreation use become circumstantial, means every occasion you start using it, like for a marriage or a get-together or birthday parties. So once you used it, and the second stage, you start using it occasionally for different purposes. Marriage function, birthday function, whatever functions or get-togethers. So first use as an experiment. Example is when you were studying in school, you as student had a get-together, and in that get-together, some of your friends introduced yourself into alcohol, and that was the first time you used, and you used it as a recreational purpose. But as you grow up, you finished your studies, you joined in a company, you are working now, and you attended a send-off party or a birthday function, and then you started using it almost occasionally. In every occasion, maybe a birthday party, whatever it may be. And slowly, your brain gets attuned, or brain gets used to the drugs. and slowly you are becoming a dependent on the drug. And the stage is intensified use, or rather a regular use. You see, you joined in your company, and occasionally you have been using drugs, and slowly you are going to have some problems, and then you start using it regularly. Previously you used once in 3 months or an occasional use. Now you are using every week, once in every week. It becomes intensified use or regular use. And the final stage, the addictive use or the compulsive stage, is you become dependent, you become addicted to that particular drug. You cannot function yourself, you cannot function your daily activities without the drugs, and that stage we call it dependent stage. And this is how the progression of addiction takes place. Thank you. Any questions? Otherwise we will wind up the whole sessions. I mean this particular session. If you have any questions, you please. Otherwise, I would hand over to the next trainer. Please, I took a little time of you. I'm really sorry. Tomorrow onwards, we will stick on to the timing. Thank you. Any questions, Dr. Parpur? Anything
Do not
else?
worry. Do not worry. Do not worry about the time. I will.
Okay.
I will quickly my session because the next session is me.
Okay. Thank you, Dr. Parpur. So, my dear friends, any questions? Otherwise, I would like to tell you something more about the coming sessions. Any questions?
Are there any questions? Yeah. If not now, you can leave your message on the chat box,
Okay.
or
Yeah.
leave on WhatsApp, and Dr.
Okay.
Francis will answer you later if you leave your message in the chat box or WhatsApp.
Okay.
All right.
Right. Okay. Right. Okay. My WhatsApp number I am just typing here for everyone, because my
Yes,
WhatsApp
thank
number
you.
is different.
We will
Yeah.
set up the group. Mahidol
This is
University walkthrough, and yeah,
this
and
is
we will
my
invite you.
WhatsApp, please. That's
Yes.
my WhatsApp number. So, friends, we are going to have 10 days of program. Today is a small session. Coming days, I may be having, not maybe, I'm having more session with you. On 18th, the whole day I am going to take. So please get prepared between to sing a song, to dance with me. All these things we will do through the virtual platform. Somebody wants to ask a question? Yes? No. Okay. Okay, thank you. Goodbye. Doctor. And others, doctor? Okay. Thank you.
Okay.
Please go ahead. Okay.
Yeah.
Thank you.
See you
Thank you,
tomorrow
Dr.
morning.
Francis. Sure.
Yeah. See
Thank
you
you.
tomorrow morning. Okay.
So, Dr. Chitse, I would like to return the floor to you before I start in a few minutes. So, let's take a break around 5 minutes before I start my presentation. So, my session will finish around, maybe I'm trying to finish within 12 and 15. Yeah, I will spend 30 minutes, around 30 minutes. Are you okay?
Sure, Ajahn. Yes, we're okay.
Okay, 15 minutes. Yeah, 15 minutes break. No, 5 minutes.
Yes, 5 minutes.
5 minutes, not 15, 5 minutes. 5 minute break.
Okay.